I am Ashok Srinivasan. This is joint work with 4 colleagues. We examine the impact of Hurricane Isaias on healthcare access in Puerto Rico. This work is motivated by the increased intensity of hurricanes due to climate change, which makes islands particularly vulnerable. Infrastructure often gets damaged then, and there's a need to understand its impact on access to healthcare. For example, are marginalized groups impacted more severely? Our specific objective is to study the impact of Hurricane Isaias on access to healthcare in Puerto Rico. We can ask questions such as the following. How did the hurricane impact the number of visitors to hospitals? How did it impact the distance people traveled to reach hospitals? Which communities or population segments were most impacted? How long did the different communities take to recover? We rely on location-based services data. Data vendors collect timestamped locations from cell phone apps for users. It has several advantages over typical CDR data from cell phones. For example, it is more accurate and has fewer restrictions. We provide a proof of concept here and leave the details for future work. Safegraph aggregates the results of the more detailed LBS data and provides it to others. It tracks the daily and weekly traffic at around 4,000 points of interest in Puerto Rico, including hospitals. For example, the data includes the following: the number of visits by hour of day to a particular business, the distance traveled from home to reach that business, home and work census block groups of visitors to that business, median dwell time, that is how much time do people spend in that business, etc. We determine descriptive statistics related to hospital visits before and after the hurricane to examine the impact of the hurricane. In the graph here, each bar along the x-axis, labeled hospitals, shows the result for a specific hospital. The y-axis is the relative number of visits in the hurricane week compared with the week before. So a value of 1 shows there is no change, a value bigger than 1 shows there was an increase, and a value less than 1 shows that there is a decrease. Results show that for 19 of the 21 hospitals, there was a decrease, with an average decrease of 35%. This decrease was statistically significant for any reasonable value of p. We also analyzed the average distance traveled from the home to the hospital and the median dwell time spent at the hospital by a visitor. There was no statistically significant change in these. We then wanted to examine if hospitals located in economically disadvantaged neighborhoods were more severely affected. But the median income of the zip code hosting the hospital was not significantly correlated with relative changes in the count of visitors, distance from the home, or dwell time. The lessons learned from this preliminary study are as follows. It is feasible to use this methodology to understand the impact of climate-driven disasters on healthcare. For example, the hurricane had a significant impact on the number of visitors visiting a hospital. In addition, some hospitals were closed. We can see which hospitals were closed using LBS data if we assume that a hospital without visitors is closed. It also suggests further questions to investigate to get an understanding to better serve disaster survivors. For example, why was there a drop in the number of visitors? Was it due to disruptions to the transportation infrastructure? Were there demographic differences underlying the drop in visitors? Somewhat detailed census block group level visitor information can help answer this.